Hi everybody, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's episode is a pretty quick question of when should you start therapy following a concussion? And I think this is something that has changed drastically over the last 20 years with new research. But still, many pediatrics, many medical doctors, many pediatricians who may be the first line doctor when a student or a kid gets a concussion is going to say, okay, just rest for a few days and see how it is and don't do anything, just go in a dark room, stay off screens, those kind of things. And I think that advice is so much in the past, and so much of maybe that doctor not knowing about all the other options that are out there. And so I want to go through, it's a little article on vestibular therapy and how starting vestibular therapy earlier had better outcomes long term. But before I get there, I just want to say that when you or your son or daughter first gets a concussion, the first thing you want to do is try to decrease all processed food coming into the body. You want to improve the inflammatory reaction as much as possible. And so that's where things like fish oil can help, maybe a little bit of fasting, but then just not eating processed junk, processed food. And that's number one. Number two is exercise. Whatever exercise that person can handle, exercise. Whether it's just laying down, doing some bicycle kicks, whether it's on a rowing machine, on a recumbent bike, whether it's walking around the neighborhood. Exercise is going to improve blood flow to the brain, which is going to help with healing in general. And so those are two fast and easy strategies that should always happen. Now, ideally, when your son, daughter, or yourself gets a concussion, then you are going to seek out medical therapy right away. You're going to seek out, first of all, advice to get a proper diagnosis, and then hopefully that diagnosis can properly show that there might be dysfunction going on. So most concussions, 80%, the majority of concussions, are going to resolve within 28 days, no problem, and there are no symptoms, but there still may be some underlying brain abnormalities, underlying activity that could affect a person through school, through work, through sport. And so that's why it's really important to seek out care that will have a proper physical exam of that individual, and so that we can properly diagnose a concussion and treat any individual abnormalities. That other 20% that have concussions are going to have long-lasting symptoms. We don't know, and that's more post-concussion syndrome. We don't know if when you have a concussion, except for a few risk factors, if you're going to resolve quickly or if you're going to resolve after 6 months, or maybe even have these symptoms for 3 or 4 years. And so that's where doing therapy early on, getting advice from qualified practitioners early on, is so important for yourself and your health. And so let's just go through that article here on how starting vestibular therapy early can be better for, and this is a sports-related concussion, but we can talk about all concussions in general. And so looking here, this article is from 2021. They're looking at how vestibular dysfunction, characterized by nausea, dizziness, and imbalance, or gait disturbance, can represent sports-related concussion subtype, okay, associated with a prolonged recovery. So obviously other concussions can have more of a mood disturbance effect, can have anxiety, depression, can have sleep disturbances, can have more pain relation like headaches. They're looking specifically at vestibular dysfunction. And so the hypothesis is that early vestibular therapy for young athletes can be associated with better return to play and return to learn and symptom resolution. So it's just a pilot study, so they only had patients aged 5 to 23. They only had 10 that were in the early intervention group and 13 in the late. And it was based off of, did you get the early intervention at less than 30 days from your concussion or more than 30 days late? Okay. In total, they saw the late therapy group required additional time to return to play. So 110 days versus 31 days for the ones that got the early intervention of vestibular therapy. That was ideally individualized to that patient. And then also had additional time to achieve symptom resolution, about 121 days for complete symptom resolution versus 54 days for the early therapy group. There was no effect in the return to learn, though, but it was mostly return to play and return to, or for complete symptom resolution. A lot of times the return to learn can get muddled with many other things because many people want to get their kids back into school as fast as possible. And so the return to learn might not be as stringent as like a return to play. And then of course the symptom resolution is a little bit different because that is completely subjective from the patient or from the student. And so conclusion, they found that initiating vestibular rehab therapy within 30 days of the sports-related concussion is associated with an earlier return to play and symptom resolution. And so therefore we need to screen for vestibular dysfunction. Clinicians need to screen for vestibular dysfunction and consider modifying these follow-up schedules to improve complete outcomes. And this is what I'm saying in that people need to know who to go to get the best diagnosis and then therefore treatment necessary so that we can improve outcomes long term, so that kids aren't having these long symptoms and they're trying to fight through going to school while they have all these symptoms or not being able to play their sport. Okay? And so right here is just a demographic of their history, basically showing that earlier therapy was not different than late therapy when it came to how many concussions they had, or was their first concussion I should say, compared to like male, female, and then also in medical history. Like the earlier treatment, actually they had 2 ADHD cases, the other one did not. There was more headaches in the earlier, and they were still had better symptom resolution, but there were a little more anxiety, depression in those that started later, possibly because they were out of their sport and still had a lot of symptoms past that. Okay, and then this is what I want to look at. So for the early therapy, the number of total therapies necessary for the early, they only needed 2.5 therapies on average, okay, versus late was 4 or 3 to 8, okay. Number of follow-ups were 1 to 2 about for the early, but they needed a little bit more for the late. But symptom resolution, days to total symptom resolution was 54 in the early therapy, 121 in the late. Again, the return to learn was about the same. We can't really change that or can't really look at that too well. But the return to play, again, much different, much better in the early therapy versus the late. So, again, moral of this video is that we should get the proper diagnosis and then the proper individualized treatment for those individuals as fast as possible so that they can improve their quality of life, because no child in middle school and high school wants to have symptoms through a whole school year. They basically lose that year of their life, and obviously, as we know, school, teenage years go by really fast. We want to make sure that they have the best time of their life in that area and be able to kind of live it to their fullest. So I hope you have gotten some good information about this one. If you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thank you again. Have a great day. Stay healthy.